So just to cover some of the key areas we're getting questions around the development programme through CPPA. One is it exclusive to only the pharmacist in the pilot? Some of the intensive support in that will be, but our aspiration is to open that out and provide a range of the resources and learning that we've got available. That'll be through the CPP website. Can't make exact promises today, but our aspiration is there's an awful big workforce out there. People have asked us around where is prescribing funded from. That will be locally by LEPBs. There's arrangements. If people want to contact CPP, we can put you in touch with the right people. But there'll be non-prescribing or medical leads within LEPBs who will be able to say there are providers. And there's, I think, 20 or so providers right across England. So that will be funded locally. The remainder of the funding comes from NHS England for the development programme, and that means that all the training costs are covered, and that includes the contact days. We're talking around about 26 over about the 18-month period, but that includes local study groups, the induction block, which we're locally calling boot camp, and some other events, so showcasing events, conference events, they'll be included in that as well. So we do recognise, though, these pharmacists will have a very varied background. So the very first part is a personal assessment evaluation using Myers-Briggs and a PDP planning session, and then we can make an individual plan for that. It sounds quite intensive, but I think it will be the best way of us doing it, and we will look to local leaders to help us with that as well.
I'll steer away from the training because I think Chris has covered most of that. If I think about the frequently asked questions I'm getting in, they're around what's the model? And I think the answer is whatever innovation you can come up with around clinical pharmacists working in general practice, we'd like to see some of those ideas. We don't have a fixed model in mind. We're very flexible about who the employing organisation is, other than we wouldn't want the CCG to be the employer and we wouldn't want the commissioning support unit to be the employer. But other than that, we're really flexible. Where we were 8 weeks ago probably isn't where we are now, in terms of thinking that through.
One of the questions that came up was about how do you evaluate your project, and I think one of the strong messages was it'd be best to work with the local universities on that, wasn't it? That you need to think about some outcome measures that are measurable, but also not going to cause massive disruption within the practice setting. But it'd be worth having an early conversation with local schools of pharmacy or other educators about researchers about what would be the best measures of outcome for the projects. The other question we keep being asked, particularly from doctor surgeries, is how do you go about employing a pharmacist? And so even with outside of the project, people want to employ pharmacists. So today, the PCPA has launched a guide on employing a pharmacist, looking at different options for employing a pharmacist or contracting a pharmacist. But also within the pack, we've got example job descriptions and we've got example job adverts. And what we've done is we've divided the job adverts into two types. One is what we've called an entry-level pharmacist, a more junior level. And we've tried to define all the different roles that pharmacist could do. And then we've got an advanced level, and that's somebody who would be a more experienced pharmacist with an independent prescribing qualification and taking a leadership role. So that guide's going to be available on the PCPA website and should be a valuable resource for anybody, including people who are actually wanting to go into these roles, because it would help them pre-interview and with their applications. Have you thought of it?
So the questions we've been asked around the models, and I don't think we have a fixed view of the models. We are very flexible and open to all sorts of innovative ideas. We would like to see a senior clinical pharmacist supporting less senior clinical pharmacists. We think clinically that's good practice, and is a model that pharmacists already work within. But other than that, we're very flexible on who the employing organisation is. We wouldn't want clinical commissioning groups, CCGs, to be the employer, and we wouldn't want commissioning support units to be the employer. But other than that, we would like to see models that meet local need, and it is about what local people need. Some of the other key questions that we have been asked around are about indemnity, and that was a really challenging question today. And we need to go away and we need to think further about how practices can evidence that the pharmacists will have indemnity or can get indemnity. We know that there are pharmacists already working in clinical practice. They have indemnity insurance. It isn't an insolvable problem. I think NHS England needs to think about how we phrase that. We've been asked about the application process, and so we have opened, and so we're going to have an online application process so people don't lose emails and they don't get lost in the system. So practices will have to register for access to the SharePoint site. They will then use the SharePoint site to complete an online application form and upload documents. So it's relatively simple, but if you are a practicing or a provider and you're thinking of putting in a bid, we'd suggest that you start thinking now about contacting us about access to the SharePoint site. The deadline for bids is 5 o'clock on the 17th of September, but we can't accept any bids before 9 a.m. on the 11th of September. So it's a reasonable, it's a window of around a week. We've been asked about who's paying for training, and I think Chris has covered most of that. For the prescriber training, that should be funded by the local LETBs, and the actual development programme for the pharmacists is also covered. There's also a development programme that's on offer for the practices themselves, which is an OD programme to support them integrate the pharmacist into their practice, and that's free. But we can't cover backfill costs, and we can't cover travel if that's needed. So that's the main thrust of it.